Hello, everybody, and welcome to another episode of Mind Matters, Navigating Head Injuries and Concussions. My name is Kiley Como, your host, and I'm the legal nurse consultant here with Shane Smith Law. Today, I'm joined again by DrRuby. Dr. Ruby, it's a pleasure to have you back and dig a little bit deeper into a pediatric traumatic brain injury.
Thank you, Kiley, so much for having me. I appreciate it.
So we got the physical, the cognitive, and cognitive therapies. That can be a little tricky, I think, especially with kids. I know with adults, I've gone through physical therapy myself, and that can get challenging, week after week after week. It can get very repetitive, can get a little frustrating. I can imagine that cognitive therapy is probably worse. And then you throw being a kid in on top of that who's got,
Right.
sometimes little patience for those sorts of things. How do you manage that? Do you have practitioners in your office? Do you send them off? Do you collaborate on cognitive therapy? How does that work with you?
Yeah, so I don't have any therapists in-house. However, I do, refer out to mental health therapists or psychologists in our areas. And the biggest thing is that I collaborate with them. On every visit, I will go back and talk with the referred provider. I'll go back and talk to the referred provider and I'll say, this is my visit with this patient and this is how it went and this is my recommendations. And I'd love to get your feedback on your visit when it's completed, because I think that is actually a very important part of the patient visits. A lot of people take mental health for granted or are not focusing on it as much, but to me, it's really important. For children that are able to, do cognitive behavioral therapy with trauma focus, that's very helpful for them. They're able to come up with basically strategies and mechanisms and just really ways to cope with this trauma that they've been through. And then as far as younger children, they're able to do play therapy. And for them, whether it's tactile stimuli, they're rubbing a stuffed animal or whatever the case is, they go from there and they are able to talk about what's happened to them. The therapist is trained in play therapy with the child to be able to bring out those emotions and feelings.
That's pretty amazing. I didn't think about the tactile therapy. And what are we trying to elicit there with some of those therapies?
The biggest thing is that we're trying to get the child to first understand what's happened, to process the information, and then come up with strategies, right? Some children want to avoid the memory completely, so making sure that it comes out and that if they have that repressed memory, that they're able to cope with it, right? Because repression is also a coping mechanism that they have established. Another thing could be that besides repressing it is that they're talking about it all the time. They're reenacting it. They're doing plays, that occurred. Daddy or mommy were driving this way and then I was sitting in the back and then this happened and then this car hit us. And they go through this whole play. They go through the whole story over and over again. So really it's okay. Well, it's nice to talk about it, but maybe let's write it down. Let's write down our feelings about it. Let's draw our feelings, so they come up with different ways and different things to just go ahead and focus, just coping strategies for them for lifelong. So that way they're able to process everything that's happened to them.
Oh, that's pretty amazing, actually. Takes quite a while, I would imagine, to completely, I wouldn't say heal, but to get back to kind of normal function. What would you say? And if you can't answer it, that's okay, because I know everybody varies. But is there a typical time span you'd like to see somebody to be back to normal, so to speak, after a mild TBI? In terms of
after
pediatrics?
A mild TBI, obviously, just like you said, it can vary per child. Sometimes some children just progress much rapidly than the others, and some just need a gradual therapy and treatments to forward on. I do see that most often it takes about 3 months for children to really improve and completing treatments and everything like that. So most often it takes about 3 months per se. Obviously there are cases where it can be longer and require medicinal therapy and other treatments.
And you kind of get into the realm of like post-concussion syndrome, that sort of thing when you get into that past that 3 month mark. Is that what you're looking at?
Absolutely. We'll talk about, things to look for, right? If they are as needed visit, I'll go ahead and list to them all the things that they need to look for if they have any of these symptoms and what to focus on. If the child ends up losing interest in activities or is more secluded or having sleep disturbances, I'll just tell them things to look for and tell them, that they can easily call me back and come back in if there's any concerns.
That's great. As I sit here listening and putting myself, as being a parent, and I think you're a parent as well, I'm sure that's a very long journey for the parent, just as it is for the patient. How do you how can you support the parent or give encouragement or education? How does that work? What do you offer?
Yeah, the biggest thing is we always recommend that parents have education about their rehabilitation, the protocols in place, but also the monitoring. So we want to make sure that they're still following closely with the child and school and the coaches and everybody to see if there's any long-term effects. Maybe the child is slowly processing things and, they're not they're having difficulty in class, or they're inattentive or confused frequently. So then we want to go ahead and add in a 504 plan that helps the child in the school system and just provide some extra help. Maybe they need extra time on their assignments or tests during this time, or maybe they need an individual, they need an IEP and they need to have more assistance in a certain class. Maybe it's math that they need help in. And so we just go from there and just really just letting the parents know that we can collaborate together for strategies and managing any long-term effects that might occur. I'm getting
a theme here. Collaboration seems to be the key, as we all know, not just with other practitioners, providers, but family collaboration. With parents, caregivers, siblings, whatnot. They all play such a critical role in getting the patient, the child, back to life. Right.
Right.
That's pretty amazing. So, long term, what kind of prognosis would you give for somebody that's had a pediatric, as a pediatric patient, has had a mild traumatic brain injury, say, 2, 3, 4 years on, or even into adolescence if they're a young patient?
I don't know if I can necessarily talk about the prognosis. I just don't know if there's enough studies yet on this. The fact that they're focusing on children is wonderful. But the biggest thing is that, a child's brain is still developing, right? And they've got their own unique challenges and things just diagnosing the TBI. But the biggest thing is whether or not they received early intervention, right? That can really, the prognosis or the trajectory can really change if they have early intervention. And that can really help them. Just finding out any behavioral issues, cognitive issues, or physical symptoms, just to really improve them and improve their prognosis.
Would you say that having had a concussion puts them at higher risk for further concussions down the road? Do you see that often?
Absolutely. Especially when we talk about athletes, they are the most at risk for second impact syndrome. And that's a teenage, age group.
Gotcha. Yeah. And would you say you see a difference between like male and female rates, if you will? If I had to guess, I would say that you've got more male patients with traumatic brain injury than female, or is that way out of left field? I'm just thinking of
no, you know what? So I think
sports.
It varies. I do think that more women suffer from mild TBIs baseline.
Really?
There's certain factors and hormonal changes that make them more prone to that. So in the teenage group, I would say, yes, athletes in general are more at risk than the normal population of like falls and things like that in the older group. But as far as all across the board in pediatric patients, or in general, I think females are more prone to it, TBIs, but I do think the athletes are just a different section in itself, that they're just at a much higher risk. And so that's the one thing that we need to tell parents and educate parents on, is basically saying, yes, your child suffered from a TBI. Yes, they can get better from it. Yes, these are the treatments to do, but they are at risk of, worsening symptoms the second time that they have a TBI. So really, we need to make sure safety precautions are in place. They're wearing helmets, they're wearing proper gear, and that if they feel off a little bit or are suffering from, a big hit, that they just sit out for a minute, collect their thoughts instead of, pushing through and causing worsening symptoms.
What would you say, what's the most rewarding part of your work for you?
For me, it's children. I love children, all ages, 0 to 18. They're all different and unique in their own ways. But for me, it's children are resilient. They always need someone to be in their corner. They need someone to advocate for them. And that's why I really love just pediatric patients in general is, some age groups are not able to tell you what's going on or what they're feeling, but you can really examine them, talking over with the parent and just be able to come to a treatment plan for them. And I really just enjoy pediatric patients overall just because of their honesty. They can't fake a symptom. It's, hey, I have to sit up. I have to sleep sitting up because my back hurts so much. You're not going to see a 9-year-old saying that or doing that. They're just so honest and, accurate with what's happening. And even the way they describe things, they'll say the whole room is spinning. Mom spins sometimes, and that's their way of saying, hey, they're just dizzy baseline.
Yeah.
So I love just trying to decode their thoughts or their actions into something that's a diagnosis.
That's a talent for sure. I have no doubt. That's pretty good. That's pretty good feedback.
Just another thing to touch on is, mental health, right? I think that's really important, new part of medicine that we really need to focus more on. And that is because anxiety and depression, those those factors can really cause worsening TBIs. And so I really need to focus on, a child might have underlying anxiety disorder, and then they just had a traumatic brain injury. And now they're just thinking about that event over and over again, but it's actually much worse. And their prognosis or, their treatment plan is much longer than a normal child because they have those predisposition factors. And so I really want to focus on, making sure that we address mental health with traumatic brain injury, because those can go hand in hand together.
Yeah, I'm glad you brought that up. We do see quite a bit of, especially with our younger clients, post-traumatic stress disorder being put on them a lot. So, and I could certainly imagine why, especially with some of the car accidents we see, it can be pretty significant. With that, it makes me think of, again, how frequently would you say, client or a patient would need to come in to see like a mental health professional? Is that usually weekly, bi-weekly? Is there a typical cadence?
Right. So usually they'll need to see, for therapy, they'll sometimes go twice a week at first, and then it'll transition to once a week or every other week. But at first, it's pretty often. And it's, if they have anxiety or depression underlying, they need to go more frequently after this. Or if they're just not progressing and it's going from acute stress reaction to post-traumatic stress disorder, they'll still probably need to go pretty often.
I think so. And then that makes me think about, 20 years ago, you usually have to go to a brick and mortar office to see a practitioner somewhere. But nowadays, we're talking via Zoom, there's telephonic. Have you seen improvements in the care you're able to provide by having that avenue to connect with patients? Do you find that being a benefit?
That is such a great point. And so telemedicine has really changed since COVID. And, I do think it's much better now. It's easily accessible to people and families in general. But the biggest thing is, a child or a family that suffered in a car accident, they're not able to get to visits as easy as, the normal patients. And so for them, telemedicine is really a necessity. And the biggest thing is that in some rural areas, it'll take them an hour and a half just to get to a doctor's office. So just baseline using telemedicine to get that care is wonderful. And in South Carolina, we're able to provide those services, especially with mental health. They're able to do telemedicine more often. Some therapists are now in school, in home, outpatient. There's just any way that they can reach a child, they'll be able to conduct the therapy sessions.
I was a bit skeptical of, the whole telehealth craze. With COVID, it really did serve a purpose, but I think it really did find its stride in there. And we found some pretty unique and amazing ways to apply that technology to provide care, even doing some forms of physical assessment, via a video screen. You have that capacity. So, that's really opened up the doors for, I'm sure, for providers like you and others to be able to connect with your patients, as you said, that may be have distance barriers or just transportation barriers in and of themselves. So that's a great point you made. Well, that's going to do it, everybody, for another episode of Mind Matters, Navigating Head Injuries and Concussions. I hope you've enjoyed this episode as much as I have. Dr. Ruby, thanks again for sharing your expertise with us. It was such a pleasure getting to speak to you. Everybody, if you please would remember to hit that like button and subscribe to our channel for our latest and greatest content. And as always, if you're in pain, call Shane at 980-999-9999.
In pain, so I call Shane. 980-999-9999. In pain, call Shane.